Hi, it's Dr. Deval Desai, and it's a very special reporting live with Dr. Desai talking about heat-related illness. It is hot outside across the country. Temperatures are rising and staying high. Many students across the country have been back to school for weeks, and other schools are starting, but we are still in the heat of the summer. And we really need to talk about what heat-related illness is, the difference between heat exhaustion, heat stroke, and just heat-related cramps. Let's get into it and see what else we can do to prevent a heat-related illness. First and foremost, let's go over some of the terminology. So if you are playing outside or your child is playing outside and it is hot and they start complaining of muscle cramps, feeling tired, that's probably heat-related cramps and signs they're probably getting dehydrated. Best thing you can do in that moment, pull them aside, put them in the shade or inside, let them hydrate. Hydrate with water or hydrate potentially with a sports drink like Gatorade, Powerade, something along that lines. Once they are better from the cramps, you can also massage the cramps a little bit, maybe put some ice on it. If they are better, once they are better, then you can get them back into the game, okay? Let's move on and talk about heat exhaustion versus heat stroke. Heat exhaustion, think of it as a precursor to heat stroke. Heat stroke is an emergency. Heat exhaustion, the patient, the child, any one of us are going to start feeling dizzy, a very rapid heart rate, fatigued, maybe a little confused, feeling like they need to sit down, feeling like they need to go inside, just feeling off. They can get shaky as well with some tremors. Those are things to look at with heat exhaustion. What do you do if you notice somebody is having signs of heat exhaustion? Immediately, they need to stop playing the game, stop playing what they're doing, stop the athletic activity and get inside or a cool area. They need to start sipping at drinks, cold drinks like water, sports drinks. You can cool them off with ice packs on their skin, in their underarms area. Also try to cool them. You want to see how they're doing. They are done with the game at that point if they are having heat exhaustion, and we need to call it a day. Let them rest, hydrate, get them home as soon as possible in a cool area. Heat stroke. When I hear the word stroke, I think emergency. If I hear heat stroke, that is an emergency where 911 needs to be called, and the patient, whether it's the child or an adult, needs to get to the hospital right away. Heat stroke is when our body temperature is rising so high. Think when we have fevers, we're maybe 101, 102. Body temperatures can go 104 to 109 degrees. It is not sustainable with life. Truly a medical emergency. Patients pass out. They are altered, meaning they're confused, not speaking right, mumbling speech, acting like they've had a real stroke. It can be catastrophic. It can be deadly. That is a 911 emergency. Heat exhaustion is a precursor. If you find somebody with heat exhaustion just isn't getting better, they also need to go to the hospital as they may be having impending signs of heat stroke. So, how much should we really be drinking and telling our little ones to drink? All right, this is a sports drink bottle, one of my favorites. It is actually 20 ounces. So if you have a patient or a child who's less than 90 pounds, we want them to do roughly 5 ounces of fluid for every 20 minutes of exercise. Think about it. 5 ounces is roughly 1/4 of this. So if they're outside for an hour, they need to have all of this in them during that hour time of hydration, okay? If they're more than 90 pounds, and that's our adolescents, those athletic ones that are out there playing, they need at least 8 ounces of fluid, water, preferably, or a sports drink, every 20 minutes of activity, for every 20 minutes of activity. So that tells you that's basically two halves of these, all right? We're gonna call it that. So what I'm getting at is hydration is very important. Sometimes we think we're hydrating, but we're not. Pre-hydration of a physical activity is important. If your child plays a sport after school in the heat, they need to be hydrating all day for it, okay? We want them to be peeing as clear urine as possible. That's not the 100% marker, but that certainly tells us versus the very concentrated yellow urine that we probably don't have enough water in us. Fruit juices, sodas, Monsters, those caffeinated drinks do not qualify as hydration. You may be asking, well, isn't water better? Water is great, But remember, as we expend energy, we expend calories and our carbohydrates and our sugar content. So sometimes the sports drinks, they have those glucose and electrolytes that we need. If we don't want to overdo it, dilute this half and half and give that to your child or whoever's outside. For our coaches out there, thank you for all that you do. Thank you for encouraging our children. Athletics are key for our growth, right? But things we need to watch out for. Make sure we're letting our athletes get acclimated to the hot temperatures. Yes, you want to push them for them to achieve their goal, but we also want to make sure we're doing it safely. Have an emergency plan, encourage hydration, encourage them to speak up if they are not feeling well. Normalize that. If you start feeling dizzy, weak, fatigued, raise your hand, come on out. That is okay. A lot of times the students, they feel fearful that they just can't do it. They're keeping up with their peers and it's too late before they do so. We need to normalize that it's okay, once again, to not be okay. Step out, we're gonna get you better. You'll be better for it tomorrow when you come back. Heat-related illness, hot topic. We all need to pay attention to it. Comes down to hydration, pre-hydration, avoiding those caffeinated sodas, beverages, fruit juices, working on knowing the difference in dehydration and mild heat cramps, to heat exhaustion that we talked about, and heat stroke, which is that medical emergency. This is Reporting Live with Dr. Desai. Stay cool out there.